You are watching the Bahamas Tonight, Northern Edition. Good evening all. My name is Madison Turnquest, and as always, it is a pleasure to have you with us. Recent outbreak of the Impetigo infection in multiple schools across the country has resulted in hundreds of students unable to attend classes. This outbreak has led to the Ministry of Health to reach out for international assistance. It has been brought to their attention that Impetigo infections are at an all-time high within CARICOM nations. This evening, we have a brief informational session with two epidemiologists from the George Eleni Chronic Disease Research Center in Bridgetown, Barbados.
Good evening, Bahamas. My colleague Dr. King and I, Dr. Branfield, wants to provide the country with important information about the Impetigo infections as there has been a recent uptick in its spread throughout the CARICOM nations. Impetigo is a skin infection that mainly affects school-age children and is caused by bacteria, usually Staphylococcus aureus or group A Streptococcus. We are quite familiar with the infection as it is first described by Tilbury Fox in 1864 and placed in the bacterial infection category by Radcliffe Cocker in 1811.
Impetigo is highly contagious and is spread mainly through direct skin-to-skin contact. Coming into contact with the sores, pus, or nasal discharge from someone who has the infection puts one at major risk for contracting the disease. It can take 4 to 10 days for symptoms to appear after exposure. These symptoms include red sores or blisters on the face, around the nose and mouth, and sometimes the hands and feet. These sores can also be found on other parts of the body. These sores then rupture and ooze pus for a few days, and then afterwards they form a honey-colored crust. Impetigo can be treated using prescription antibiotics, a good skincare routine, and sometimes even bleach baths. With the antibiotics, apply this prescribed antibiotic ointment or cream to the sores 2 to 3 times a day, or however many times it is directed by your physician. If the Impetigo infection is widespread, one will need to take oral antibiotics in the form of syrups or tablets. It is important that you complete the entire course of antibiotics even if the sores start to heal. Types of antibiotics used include amoxicillin and clindamycin.
Skincare. Wash the affected areas with soap or cleanser daily. Soak the area with a wet washcloth to remove any crusting. Use an antibacterial soap or cleanser such as chlorhexidine. Cover the affected areas with a clean bandage. You can also use bleach baths. Dilute bleach in a full bathtub of water. Soak in the bleach bath for 20 to 30 minutes and repeat this 2 to 3 times a week.
Impetigo can also be treated using topical aloe or hydrogen peroxide cream. However, these treatment methods only work if the impetigo is localized. If it is left untreated, impetigo can lead to skin abscesses.
To prevent the spread, avoid direct contact with others. Do not share personal items such as towels and clothes. Ensure that you clean any cuts, scrapes, or insect bites as soon as possible and wash hands often. For those who are already infected, resist the urge to touch or scrape the sores. Use a clean washcloth and towel each time you have a bath, and wash all clothes, towels, and bedding that you have come in contact with. Some risk factors for impetigo are age, as it is most common in school-age children, close contact as it spreads easily within families, and persons who are in close contact with each other. Broken skin from cuts, insect bites, as the bacteria often enters the skin through these breaks. Warm, humid weather as it is most common in tropical nations.
Unfortunately, there is no vaccine available for the impetigo infection, and one's previous infection does not grant them immunity. So even if you had the disease before, there is still a high chance that you can contract the disease again.
Impetigo often looks different on brown skin in comparison to lighter skin complexions. So it is important for our Caribbean people to take any blister or cut on the skin seriously and report to your current health care provider as soon as possible.
Thank you so much, Dr. King and Dr. Banfield, for providing our country with information. Now, a word from our very own Minister of Health on the matter.
We believe that it is currently unsafe for our children to be in school. It is advised that all schools across the country resort to online learning resources. While Impetigo is common in school-aged children, that does not mean that adults cannot become infected as well. Parents, please remember to take necessary precautions to prevent the spread. Having children sleep in separate beds, not having shared towels within the home, practicing good hand hygiene, and maintaining physical distance between yourself and others are just a few ways in which we all can do our part to prevent further spread of the infection within our country.
That will conclude our segment on Impetigo. In other related news, nurses at the Rand Memorial Hospital have